Okay, so this is ATI Chapter 4, Nutrition, Guidelines for Healthy Eating. Nutrition is vital to maintaining optimal health. Healthy food choices and controlling weight are important steps in promoting health and reducing risk factors for disease. Nurses should encourage favorable nutritional choices and can serve as informational resources for clients regarding guidelines for healthy eating. Established guidelines for healthy eating that clients and nurses can refer to include the Dietary Guidelines for Americans and MyPlate, along with several condition or system-specific guidelines. Vegetarian diets can meet all nutrient recommendations. It is essential to consume a variety and correct portions of food to meet individual caloric needs. Dietary Guidelines for Americans. The U.S. Department of Agriculture, which is USDA, and the U.S. Department of Health and Human Services, which is HHS, publish the Dietary Guidelines for Americans jointly every 5 years. These guidelines are based on evidence-based advice concerning food intake and physical activity for Americans. The new 2020 to 2025 guidelines are in the first edition that provide recommendations by life stage beginning with birth and continuing through older adulthood. The updates can be found on the USDA and health.gov websites. The Dietary Guidelines for American advocates healthy food selections, a variety of fiber-rich fruits and vegetables, whole grains, low-fat or fat-free milk, and milk products, lean meat, poultry, fish, legumes, eggs, and nuts. Recommendations include nutrient-dense foods and beverages. The 2020 to 2025 guidelines provide 4 overarching guidelines to encourage healthy eating patterns for each stage of life. Follow a healthy dietary pattern at every stage of life. For about the first 6 months of life, exclusively feed infants human milk or iron-fortified infant formula if human milk is not available. Provide supplemental vitamin D beginning soon after birth. At about 6 months, introduce nutrient-dense complementary food that include a variety of foods from all food groups. From 12 months through older adulthood, follow a healthy dietary pattern that meets nutrient needs, achieves a healthy body weight, and reduces the risk of developing chronic disease. Customize and enjoy nutrient-dense food and beverage choices to reflect personal preferences, cultural traditions, and budgetary considerations. The dietary guidelines provide a framework that is designed for customization for individual needs and preferences as well as foodways of diverse cultures. Focus on meeting food group needs with nutrient-dense foods and beverages and stay within calorie limits. Core elements of a healthy dietary pattern include vegetables of all types. This is dark green, red, and orange beans, peas, and lentils, starchy and other vegetables. Fruits, especially whole fruits. Grains, at least half should be whole grain, and dairy, fat-free or low-fat milk, yogurt, and cheese or alternatives if needed. Protein foods are lean meat, poultry, and eggs, seafood, beans, peas, and lentils, nuts, seeds, and soy products. Oils are vegetable oils and oils and foods such as seafood and nuts. Limit food and beverages with high amounts of added sugars, saturated fat, and sodium. Foods and beverages high in added sugars, saturated fat, or sodium, as well as alcoholic beverages, should be limited. Added sugars starting at age 2, less than 10% of calories per day. For those younger than age 2, avoid foods and beverages with added sugars. Saturated fat. Choose monounsaturated and polyunsaturated fats from fish, lean meats, nuts, and vegetable oils. Starting at age 2, limit to less than 10% of calories per day. Sodium less than 2,300 milligrams a day. That's about 1 teaspoon of salt. Limit canned and processed foods. Prepare foods without adding salt. Alcoholic beverages, drinking less is better for health. If choosing to drink alcohol, drink in moderation by limiting intake to 2 drinks or less per day for men and 1 drink or less in a day for women. General dietary recommendations for adults based on the Dietary Guidelines for Americans. Recommendations are based on a 2,000 calorie daily diet. Vegetables is 2.5 cups per day, including a variety throughout the week. Green vegetables, orange and red vegetables, starchy vegetables, peas, and lentils. Fruits is 2 cups per day. Grains is 6 ounces per day, including more than 3 ounces of whole grains. Dairy is 3 cups a day. Protein is 5.5 cups per day, including poultry and other meats, eggs, seafood, soy, nuts, and seeds. Oils is 27 grams per day. The Dietary Guidelines for Americans also establishes recommendations for age groups: toddlers ages 12 through 23 months who are no longer receiving human milk or infant formula, children ages 2 through 8, children and adolescent ages 9 through 13, adolescents ages 14 through 18, adult ages 19 through 59, women who are pregnant or lactating, and adult ages 60 and older. Follow food safety guidelines when preparing, cooking, and storing food. Avoid consumption of raw eggs and unpasteurized milk and juices. These strategies are beneficial for cooking foods at home. When using convenience foods or boxed meals, add healthy ingredients like frozen vegetables, canned legumes to increase the volume of food and add nutrition. Decrease the amount of salt or seasonings containing sodium when cooking. Buy side items that increase the nutritional value of meals. Packaged salad kits, pre-cut fruit, whole grain bread. When eating out, these strategies can help meet nutritional guidelines. Eat a snack with high fiber content 1 hour before the restaurant meal to decrease hunger. If a restaurant meal will be high calorie, eat lower calorie, nutrient-dense foods for other meals that day. Ask for items with high fat content on the side, for example, dressings, sauces, gravies, and creams. Base restaurant choices on those that offer healthy options. Physical activity is one of the most important things an individual can do to improve their overall health status. Establish exercise routines to promote cardiovascular health, muscle strength and endurance, and psychological well-being. Benefits of physical activity start accumulating with small amounts in activity and immediately after completing the activity. My Plate. The USDA sponsors a website that promotes healthy food choices balanced with physical activity. My Plate is based on the current USDA dietary guidelines and is a tool to help individuals identify daily amounts of foods based on criteria, age, sex, activity level. The food groups represented are grains, vegetables, fruits, dairy, and protein foods. My Plate can serve as a reminder to balance calorie intake with suitable activity. Multiple resources are available, such as My Plate Kitchen, where a client can find recipes and resources within the kitchen and ideas for healthy eating tips on a budget. The My Plate website offers age and lifestyle specific information and resources for women during pregnancy and lactation. Resources are available for the older adult population. The My Plate image and information sheet are available in multiple languages to assist with client education. Vegetarian diets. A vegetarian diet focuses on plants for food, including fruits, vegetables, dried beans and peas, grains, seeds, and nuts. There is no single type of vegetarian diet. Vegetarian eating patterns usually fall onto the following groups. Vegan diet excludes all meat and animal products. Raw vegan diet is a strictly uncooked food eating pattern based on fruit, vegetables, nuts, seeds, legumes, and sprouted grains. Uncooked food ranges from 75% to 100% of total food consumed. Lacto-vegetarian diet includes dairy products. Lacto-ovo vegetarian diet includes dairy products and eggs. People who follow vegetarian diets can get all the nutrients they need, but they must be careful to eat a wide variety of foods to meet their nutritional needs. It is important to discuss ensuring enough vitamin D and B12, calcium, and omega-3 fatty acids are consumed by clients who follow a vegan diet. Vegetarian diets and eating patterns can be beneficial and can reduce the risk and aid in the treatment of certain health conditions, including ischemic heart disease, type 2 diabetes, and certain cancers. Food labels. The Food and Drug Administration, or FDA, requires certain information to be included with packaged foods and beverages. The information is included on the nutrition facts label or food label, which is a box label found on foods and beverages. Food labels must include the name and form of the product, the net amount of food or beverage by weight, measure, or count, and the name and the address of the manufacturer, packer, or distributor. The percent daily values information is typically based on a 2,000 calorie a day diet. The label must contain the ingredient list, and the foods must be listed in descending order by weight. Multiple changes have been made to food labels to reflect how individuals currently eat and drink. Nutrients included on the food label. Actual amounts of nutrients declared, not just the percentage daily value. Calories in larger bold type, total fat, saturated fat, trans fat, cholesterol, sodium, total carbohydrates, dietary fiber, sugars, included in grams and as a percent daily value, protein, vitamin D, potassium, calcium, iron. Manufacturers are required to clearly state if a food product contains any of the 8 allergens that are responsible for 90% of all food allergies, such as milk, eggs, fish, crustaceans, shellfish, tree nuts, peanuts, wheat, and soybeans. Foods marketed as functional foods might be whole foods or foods with additives, herbs, and minerals. These foods are often advertised as having the ability to prevent or promote disease. There are currently no regulations regarding functional foods. Organic food products are regulated under the USDA. Organic foods are produced without the use of pesticides or synthetic fertilizer. Organic livestock must have the ability to graze on pastures, are fed 100% organic feed, and do not receive hormones or antibiotics. Organic foods can reduce the risk of pathogen resistant to antibiotics. While they reduce exposure to pesticides, there is no evidence that it is a healthy effect. Clarify misinformation about these foods with clients. Client education. Read food labels properly, comparing nutrient, calorie, fat, and sodium levels to ensure individual nutritional needs are met and healthy choices are made. Goods that are genetically engineered or contain genetically modified organisms or GMO have not been proven harmful. Strategies for promotion of specific areas of health. Heart. Limit saturated fat to 7% of calories. Limit intake of red and processed meats, refined grains, added sugars, butter, high sodium foods, and commercial trans fats. Consume a diet higher in fiber, vitamins, antioxidants, minerals, polynutrients, and unsaturated fat, and lower in glycemic index. The dietary approaches to stop hypertension, or DASH, diet is proven by research to significantly lower systolic and diastolic blood pressure, as well as low-density lipoprotein cholesterol. Neurologic system. Normal functioning of the neurologic system depends on adequate levels of the B-complex vitamins, especially thiamine, which is B1, biotin, and vitamins B12 and B6. Calcium and sodium are important regulators of nerve responses. Consuming the recommended servings from the grain and dairy food groups provides these nutrients. Bones. Consuming the recommended servings from the MyPlates dairy group supplies the calcium, magnesium, and phosphorus necessary for bone formation. Weight-bearing physical activity is essential to decrease the risk of osteoporosis. Bowel function. Normal bowel functioning depends on adequate fluid intake and 25 grams a day of fiber for females and 38 grams a day for males. The minimum number of servings from MyPlate fruit, vegetable, and grain food groups, specifically whole grains, provides the essential nutrients. Cancer prevention. A well-balanced diet using MyPlate and a healthy weight are guidelines to prevent cancer. Increase high-fiber, plant-based foods. Limit saturated and trans fat while emphasizing foods with polyunsaturated fats, which is omega-3 fatty acids. Limit sodium intake, avoid excess alcohol intake, and include regular physical activity. Okay, here's some questions. A nurse is conducting a nutrition class at a local community center. Which of the following information should the nurse include in the teaching? This is limit saturated fat to less than 10% of the total daily intake. A nurse is providing teaching to a client who follows vegan dietary practices. The nurse should instruct the client that there is a risk of having a deficit in which of the following nutrients. And this is a select all that applies. So I'm going to do A, C, D. Vitamin D, calcium, and whole grains, or vitamin B12, not whole grains. A school nurse is teaching a group of students how to read food labels. Which of the following is a required component of food labels that the nurse should include in the teaching? Total carbohydrates, total fats, calories, and dietary fiber. A nurse is discussing essential nutrients for normal functioning of the nervous system with a client. Which of the following should the nurse include in the teaching? Oh, I guess all of them. Calcium, thiamine, B6, sodium, and phosphorus. Okay, now we're going to go on to Chapter 5, which is food safety. Food safety is an important concept in nursing. It is essential to provide clients with the necessary education regarding food safety and food medication interactions. Food safety concerns include preventing aspiration of food, reducing the risk of foodborne illness, assessing for food allergies, and understanding food medication interactions. Food safety guidelines. Ingestion of food poses a risk of aspiration in some circumstances. To minimize the risk of aspiration, food should be consumed only by individuals who are conscious and have an intact gag or swallow reflex. For clients who have a known risk of aspiration following a stroke or procedure involving anesthesia of the esophagus, it is important for nurses to monitor the client's ability to swallow prior to eating. Young children are at an increased risk for aspiration of some foods. Food safety requirements include proper food storage, proper handling, and proper preparation. Food storage guidelines. Fresh meat. Maintain refrigerator temperature at 40 degrees Fahrenheit or 4 degrees Celsius or colder. Bacon is good for 7 days. Sausage, pork, chicken, beef, turkey is 1 to 2 days. Summer sausage is 3 months unopened, 3 weeks opened. Steak, chops, and roast. Beef, veal, lamb, or pork. This is 3 to 5 days. Chicken or turkey, whole or parts, is 1 to 2 days. Fish, maintain refrigerator temperature at 40 degrees Fahrenheit or 4 degrees Celsius or colder. Leaner fatty is 1 to 2 days. Smoked is 14 days. Fresh shellfish is 1 to 2 days, and canned is 3 to 4 days after opening and 5 years in the pantry. Eggs is stored in the refrigerator for 3 to 5 weeks in shell and 1 week if hard-boiled. Fruits and vegetables. Refrigerate perishable fruits and vegetables at 40 degrees Fahrenheit or 4 degrees Celsius. All pre-cut and pre-peeled fruits and vegetables should also be refrigerated. Perishables. Do not leave at room temperature for more than 2 hours. 1 hour if the temperature is 90 degrees or above. Canned goods. Check for rusting, crushing, and denting. Observe for stickiness on the outside of can, which can indicate leakage. Do not use any canned foods that are damaged. Handling guidelines. Wash hand and food preparation surfaces frequently and before handling food. Separate foods to avoid cross-contamination. Preparation guidelines. Cook food to the proper temperature followed by a 3-minute rest time. Roasts and steaks is 145 degrees. Chicken is 165 degrees. Ground beef is 160 degrees. And products that contain eggs is 160 degrees. Packaging labels. Sell by date, the final recommended day of sale. Use by date is how long the product will maintain top quality. Expiration date is the final day the product should be used or consumed. Foodborne illnesses occur due to improper storage of food products, as well as unsafe handling and preparation. To decrease the incidence of foodborne illnesses, primary education should be conducted by nurses. Proper handling and preparation are simple and include performing frequent hand hygiene. It is important to refrigerate food products when necessary and to avoid cross-contamination when preparing food. Food should be heated to recommended temperatures to kill unwanted bacteria. Following these basic principles can prevent the occurrence of foodborne illnesses. Foodborne illnesses pose the greatest risk to children, older adults, immunocompromised clients, and pregnant clients. Viruses can cause most foodborne illnesses, but bacteria are responsible for most deaths caused by foodborne illnesses. Foods most associated with foodborne illness are the following: raw or undercooked foods of animal origin, raw fruits and vegetables contaminated with animal feces, raw sprouts, unpasteurized fruit juice and milk products, and uncooked food handled by someone who is ill. Bacterial is Salmonella, occurs due to eating undercooked or raw meat, poultry, eggs, fish, fruit, and dairy products. Common manifestations include headache, fever, abdominal cramping, diarrhea, nausea, and vomiting. This condition can be fatal. Escherichia coli or E. coli is raw or undercooked meat, especially ground beef, can cause this foodborne pathogen. Findings include severe abdominal pain and diarrhea. The pathogen can also cause hemolytic uremic syndrome, which manifests as severe anemia and kidney failure. Listeria monocytogenes is soft cheese, raw milk products, undercooked poultry, processed meats, and raw vegetables can cause this illness. Listeria causes significant problems for newborns, pregnant clients, and immunocompromised clients. Onset occurs with the development of a sudden fever, diarrhea, headache, back pain, and abdominal discomfort. It can lead to stillbirth or miscarriage. Viral. Norovirus, a viral infection caused by consuming contaminated fruits and vegetables, salads prepared by someone who is infected, oysters, and contaminated water. Norovirus is very contagious and has an onset of 24 to 48 hours. Manifestations include projectile vomiting, fever, myalgia, watery diarrhea, and headache. Food allergies. Nutritional assessment data collection includes identification of food allergies. A food allergy is a reaction that will occur each time the client is exposed to the food and initiate release of serotonin and histamine. Food intolerance do not occur consistently and are dependent on the amount of food eaten. Milk, peanuts, fish, eggs, soy, shellfish, tree nuts, and wheat are the most reported food allergies in adults. Some infants exhibit an allergic reaction to cow's milk and or soy, but typically outgrow this by 4 years of age. Common manifestations of food allergy include nausea, vomiting, diarrhea, abdominal distension, and pain. Some reactions are severe and can cause Foods and medications can interact in the body in ways that alter the intended actions of medications. The composition and timing of food intake should be considered in relation to the medication use. Foods can alter the absorption of medications. Increased absorption improves the peak effects of some drugs when taken with food. Decreased absorption is food can decrease the rate and extent of absorption. Reducing the rate of absorption delays the onset of peak effects. Reducing the extent of absorption reduces the intended effect of the medication. Some medications cause gastric irritation. It is important to take those medications, ibuprofen, amoxicillin, some antidepressants, which is bupropion, with food to avoid gastric upset. Some foods alter the metabolism and actions of medications. Grapefruit juice interferes with the metabolism of many medications, resulting in an increased blood level of the medication. Foods high in vitamin K, which is dark green vegetables, eggs, and carrots, can decrease the anticoagulant effects of warfarin. Foods high in protein can increase the metabolism of the anti-Parkinson's medication levodopa, which increases the medication's absorption and amount of transported to the brain. Tyramine is a naturally occurring enamine found in many foods that has hypertensive effects like other anamines, norepinephrine. Tyramine is metabolized by MAO, and clients taking MAOIs like phenelzine and segolene who consume foods high in tyramine can suffer of hypertensive crisis. Foods high in tyramine include aged cheese, smoked meats, dried fish, and overripe avocados. Herbal supplements can cause potential interactions with prescribed medications. It is important that any herbal medication consumed by a client be discussed with the provider. Nursing assessment, data collection, and interventions. Nursing assessments should include a complete dietary profile of the client, medications, herbal supplements, baseline knowledge about food safety, and food medication interactions. Nursing interactions should include basic teaching about food safety and the interactions between food and client medications. Teach the client about the difference between food intolerance and food allergy.